Hello, lovely. How are you? Good. So, what seems to be the problem? Okay. Whereabouts? Yeah. Right, okay. How severe is the pain? Okay. How long has this been going on for? Okay. Just open your file. Alright. I'm going to ask you some questions if that's okay. Good. Right. Okay. Have you got any ear pain at all or ear pressure? Okay. Is that all the time? Okay. Any headaches at all? Is that normal for you? Okay. Would you say they're migraines or more of a headache? Okay. About here? Do you find it may go down into your cheeks? Okay. Okay. Are you experiencing any aching teeth or gums? Okay. Got any cough? Change in your sense of smell? Okay. Right. Have you had a fever at all? Or okay. Any recent colds? Okay. Right, so how long ago was that? Okay, so that's 6 months ago, and that was just a mild cold. Okay. So no fever or it's a runny nose, stuffy nose, okay. Watery eyes. It's a typical cold symptoms. How soon do you start experiencing this issue after the cold? Okay, so some time. Okay. So you'd say at 2 months. Right, okay. Okay, that's fine. So, do you experience any nasal congestion at the moment? So, not necessarily streaming, not necessarily where you keep sniffing or you feel like you can't blow your nose or anything like that. Just sort of here, can you sort of feel something? Would you say it's quite dry? Okay. And do you get any runny nose or anything like that? Okay. So it's just more the pressure and the pain. Alright, okay. Alright, my lovely. I know. It's okay. I'll get this sorted for you, promise. Alright. Okay. So, would you say you've been getting any discharge at all? Okay. And what about any nosebleeds? Okay, so it's just a slight little bit of blood when you blew your nose. Okay, we can get that sometimes. Okay. Okay. If you could bend your head for me, okay? Just right down to your chest. Any pain or pressure in the nose? Okay, back. Can you stand up for me and bend over as far as you can for me from the waist? Okay. Any pain or pressure? Okay, you can pop back up. Okay, yeah, so worse. Okay. Have you noticed that before? Okay, so not took any notice of it. Yeah. Okay, and finally, have you got any congestion in your throat at all? Are you a lot, or are you bringing anything up, or does it feel quite blocked? Any achy throat? Okay. Okay. So I get you just to pop on these scales for me. They're just over there. Okay. Okay, that's perfect, thank you. I haven't got another reading for you, but that is well in the perfect range. Okay. Right. So I've got that's fine. Let me just check your medication. Okay, so that's good. So you're not on too much medication. Okay. I know you're still taking all those as you should. Great. Okay, and your medical history. Let's have a look. Okay. Is there any medical issue I need to be made aware of at the moment? Okay. Okay, that's fine. Great. Do you suffer with hay fever usually or not? Okay, what about any known allergens? Okay. Do you smoke or vape at all? Okay. And asthmatic, that's fine. Any family history of any sinus issues or migraines? Okay, so family history of migraines, sinus issues. Okay. Have you had any sinus issues before? What about migraines? Okay, so history of migraines. Sinus issues before. Okay. Does anything improve the congestion or the pain and pressure? Okay. Does it come and go? Would you say anything makes it worse? Okay. Okay, that's fine. Okay. Okay, that's fine. Okay, right, my love. I'm going to have to examine you. Okay. Right. Are you okay? Yeah. All right. Affecting everyday life. Yeah. We need to get this sorted, don't we? I'm going to start off by just having a feel around your sinuses, okay? Alright, I'm just going to come a little bit closer to you. Right. I'm just going to see if there's any swelling around. Just by the edge of your ears there. Any pain there? Okay. Any pain or pressure? If you could just let me know. Just push quite firmly. Okay, that's your brows. Push down the side of your nose, okay. Really tender there. Okay. I'm going to go across your cheeks. I'm going to squish to your nose. Okay. Close your eyes for me. Any pain in the eye? Okay. glands feel good. Say anywhere's worse than somewhere else. Okay. So here and here and there. Just smile for me. Any pain when you smile? Okay. You can stop. Can you clench for me? Any pain? Okay, relax. I'm going to go like this. Can you just tell me where's more painful? Okay. Okay. Just tell me which side hurts more, okay? Okay. Anywhere worse? Okay. Whereabouts that? Okay. Which side would you say is worse? Okay. I'm just going to feel down your neck, okay? across your chest, okay. Okay. Okay, if I can get you to tilt back for me, I'm going to have a look at your nose. Okay. Okay. I'm just going to press there. What's that feel like? Okay. Right, the other side. Press there. Okay, just relax for me a moment. I'm just going to get one of these. I'm just going to pop it to the back of your nose and just try to gently remove some of that hard congestion. Okay, I just want to have a look at it. Okay, I will be really gentle, but it might be a little bit sharp. Okay, I'll be gentle, I promise, okay? Alright. Let me just tilt your head for me. Okay. Again, this one now. I know, I'm so sorry. That's it. Try to control your breathing through your mouth. That's it. Good. You do really, really well. Okay. There we go. That's all done. I know, I'm so sorry. Okay. Have a look with my magnifying glass, okay? Yeah. Okay. Okay, you're right. Good. I'm just literally going to look here where your tear ducts are, okay? If you can just look right at me. Okay. The other side. Okay, I'm going to have a look at your nose. I'm going to use this so I can get a closer look. Okay, tilt back for me. Okay. Okay. Oh yes, I could definitely see that. It's very compacted. Okay. On the other side. Okay, relax for me. Okay, put that in, change that. Right, can I look in your ears? Great. Okay. Just relax for me. Okay. Do you pain your ears at all? Okay. Well, can't see anything red anyway. Oh, looks really good. Okay. On the side. Right. Okay. This looks really good. Perfect. Great. Okay, I'm going to check your temperature. That's fine. Okay. Good. Right. Okay, I'm now going to do your blood pressure. Okay. Right, I'm going to use this arm. If you could just relax it on the table for me. Okay, let's just see if this is working fine. Perfect. You could just pop your arm there for me. Okay. Relax. Okay. All right. That's perfectly fine. Okay. Excellent. Right. I believe you are suffering with sinusitis. Have you heard of that before? So you sort of know what it is. Great. So, I'd say all your sinuses are infected. So, your frontal, your maxillary, okay, your ethmoid, and your sphenoid, which is deeper behind the bridge and the eyes. Okay, I would say that your maxillary and your ethmoid are the worst. Okay, yes, you can get chronic sinusitis, but I think you've got acute sinusitis. Okay, that's what I'm going to treat you for at the moment. If the treatment doesn't work, I will carry out some further tests if we need to. And if this continues and doesn't get better and it lasts longer than, 3 months or so, I would say that you're probably suffering with chronic sinusitis. Okay, and we can look at other treatments and different things like that. So I'm going to give you a prescription. Okay, so I'm going to give you a saline nasal spray. I need you to use that several times a day. Okay, about twice. Nasal corticosteroids. Okay, so some steroids that will help prevent and treat the inflammation. Okay, it's twice a day, please. Then I'll need you to take some ibuprofen twice a day. Okay. And some paracetamol when needed. Okay. And I need you to get plenty of rest and have plenty of water. Okay. What I recommend you doing at home to help relieve any congestion, if you haven't got a face steamer, I would say get a bowl of boiling water. Get a towel, put it round your head, and put your face in the bowl. Okay, if it gets too much, please pop the towel off and sit yourself back up. Okay, that's quite good for your skin as well. But you know, that's really going to help relieve any congestion. You can pop some eucalyptus in there as well if you have some essential oil. Okay, that's fine. Steam rooms are again great. Hot steamy showers are really good as well, but please be careful because that can raise your blood pressure. We don't want you getting dizzy or faint. Okay, yeah. Okay. Yeah, so what happens is the spaces inside your nose, which are your sinuses, become inflamed and swollen. Okay, that's what happens, and that obviously interferes with the drainage and things, and you can get mucus, blockages, and all sorts of things like that. Yeah. Well, sometimes you might be difficult to breathe, smell, and might, you know, be a bit difficult in your eyes, especially when you've got headaches and things. Yeah. What I will do, I'm going to give you some migraine relief. Okay, migraine relief. So take that when needed. Okay, leaving a 4-hour gap. Okay, no more than 6, please, in the day. Okay, that should really help. Okay, the pink ones also have an anti-sickness in, so it'll help relieve any sickness from any headaches and migraines. Okay, but also from the medication. Yeah, sometimes it can just happen. Other times it can be triggered by the common cold or the flu, which is why I asked you about the cold. However, it took about 3 months for this to trigger. Sometimes it's usually quite early on and soon after the cold, but we can't rule it out. It could well be from the cold. Other times it just happens, unfortunately. Okay, yeah, that's right. We'll try and get it under control for you. Okay, so you can get all sorts of pains and throbbing and things like that. It's not very nice. So there is your prescription. If you wouldn't mind getting that for me today and starting the treatment. Alright, I'm not going to issue any antibiotics at the moment. I don't feel it's necessary. I want to try this treatment, and if I am concerned a bit down the line if we have an infection, I obviously will prescribe you some antibiotics, but at the moment I want to start with this. I would like to see you again in 4 weeks. Okay, let me just have a look. I've got 11 AM on the Wednesday. 4 weeks. Okay, I'll pop you in there. So that's a sinus review. If you wouldn't mind keeping a little diary for me as well, just let me know how you get on. Symptoms, pain, how you're feeling and stuff like that. If for any reason you are really struggling and things have escalated, please ring and I will get you in to see you. Okay, my lovely. You're very welcome. Alright, you just take it easy, okay? Good. You take care now. Bye-bye. Hello, lovely. How are you? Good. I'm very well, thank you. Another year has passed and you're back for your annual physical exam. How have you been keeping? Good. Well, that's great. I'm just going to load up your profile and check your medical history. Is there anything you would like me to add? Okay. That's fine. No problem. I'll have a look for you. Okay. Right. So you've been experiencing a little bit of joint pain. Okay. Anywhere in particular? Okay. Joint pain in knees and hip. Both hips, one side. Okay. So your left side. What about your knees? Okay, so both. I will have a look for you in a moment, alright? Okay. Okay, so medication. Are you all up to date with your medication? Is everything alright with your medication? No concerns? That's really good. Okay. Have you been taking any over-the-counter medication, supplements, or any pain relief or anti-inflammatory? Okay, so is that the 8mg? Yes, the 500. Okay. And how often have you been taking that? Okay, so quite regular. And is it helping you at all? Okay. And some ibuprofen. Have there been any new diagnoses in your family? Cancer, arthritis, diabetes, or anything like that? Okay. Great. Any changes to your weight? Okay. I will get you to go on the scale soon, okay? And what about your exercise? Well, that's good. And how are you getting on with that? And you like it? Well, that's really good to hear. And how many times a week? Great. what about your alcohol consumption? Alright. Is that mainly wine, beer, spirits, or a mix? Okay. And are you smoking or vaping? Okay. Do you have any concerns with your sleep pattern or your mental health? Okay, so you're getting quite a good amount of sleep. That's really good. And your stress levels are not too bad. That's really good. Great. Is there anything that you're concerned about? That's great, so just the joints. Alright. Okay, that's fine. Don't worry, I'll have a look and I'll sort some kind of pain relief for you. Alright, don't worry. Okay. So, no concerns. Perfect. Right, did you do me a urine sample? Great. Let me just pop on my gloves and then I will test that. Okay. Yeah, if you wouldn't mind just popping it there for me. A good colour. Okay, let's have a look. Have you had any problems with your waterworks at all? It's about your bowels. Okay. I'll just leave that there. Let me just have a look. That's looking great. That's all good. Okay. Can I just start by having a listen to your pulse? Okay. Okay, just relax for me. Just breathe normally. Okay, you can relax. Can I take this off? Okay. Pop your arm there for me. That's it. Okay, just relax for me. Okay. Okay, just breathe normally. Okay. Start to go a little bit tight. Thank you. It's really healthy and good. Could I get you to just pop on the scales for me? Thank you. Just have a look. That's great. Thank you. Let me just check that against last year. Okay, it's stayed fairly steady, okay, give or take, but nothing that I'm concerned about. Alright. But I'm thinking that's down to muscle mass with you working out. Alright, which is really great. Could I get you to just pop up against the height chart? Thank you. Alright. That's it, nice and straight for me. Good, perfect. And relax. You never know, some people do start shrinking. But you're exactly the same. Just going to check your BMI. It's perfect. Do you have a personal trainer? Okay, and they do measurements. Oh, that's wonderful. I'm really pleased. I'm glad to hear that. I bet you're really proud. You are looking absolutely amazing. You've done really, really well. It's a little bit of definition coming in your arms. Yeah, looks great. I'm so pleased for you. Let's put that down. I'm very happy. Because I know you were a little bit concerned last time, weren't you? Yeah. Yeah, I'd definitely say you put on muscle mass and you're looking very nice and trim. Yeah. Oh, did he say that? That's brilliant, yeah. That's right, so it can slightly fluctuate. Sometimes look a little bit higher and people get on the scales and they get concerned about things, but there's a lot more to it with inches and things like that. Yeah. No, it's absolutely wonderful. All right. Okay. I'm going to have a listen to your chest, okay? So I'm just going to have a listen to your heart first. Okay, if you could just raise your top for me. Thank you. Cold. Breathe normally for me. Sounds nice. Okay. I'm just going to have a listen to your lungs now. Sounds nice and clear. Just take a couple of deep breaths. Good. I'm going to go around the back, okay? You can just lean forward for me. So just continue to breathe normally. And a couple of deep breaths. Perfect. Pull your top down. Both your heart and lungs sound really good. All right. I'm going to check your temperature. Okay, I'm going to pop it in your ear. Wonderful. That's good. Any problems with your mouth at all, in your throat, gums, teeth? Okay, you're up to date with your dental checks. Okay, that's really good. I'm going to have a little look in your mouth, if that's okay. Great. Just tilt your head slightly and just open your mouth. Okay, thank you. Okay, can you say "ah" for me? Good. Okay, it's looking really good. Throat looks clear. Open wide for me. Okay, so just stretch your mouth. Okay, the other side. Wonderful. I can just have a feel. This feels great. Tongue feels good. Gums clear. Cheeks, your mouth. Wonderful. Any problems with your hearing at all? Okay, what about your eyes? Okay, up to date with your eye appointments, the opticians. Okay. Right. Just going to have a little look in your ears. Just relax for me. Any pain at all? Okay. Just going to have a little feel around, okay? The other side. Okay. Just going to have a feel. Okay. So the right ear has a little bit of wax built up, okay, and a little bit of dry, flaky skin. Okay. Yeah, have you been itching a little bit? You have. Okay. Any pain or whistling, popping? Okay. Yeah, I appreciate that. Sometimes people don't think it's anything to worry about, so they don't say, which it isn't at all. Yeah, you probably need an ear clean. Alright. Yes, definitely on that side, but it might be worthwhile on this side as well. Just a nice little clear. Alright. I do want to keep an eye on this. It might be an idea of having a little bit of a hearing test as well, so you're getting the ringing in your ear and the popping. Okay. No, it's nothing to worry about, honestly. Alright, how long have you been experiencing those symptoms? Okay. Right, that's fine. Alright, so it's only a slight blockage. Alright. Okay, so that's that one. Yeah, cleaning. Perfect. Right. I'm going to have a look in your eyes now. If you could look at my nose. Okay, this will be bright. Okay, Okay. Any glaucoma in the family? Okay. Okay, if you could just look at the end of the light for me, just for your eyes. Keep looking at that. Okay. Perfect. And just follow the tip of my finger, just with your eyes. Okay. Okay. Not there for me. Same again. Look at my face. Tell me when you can't see them anymore. Okay, I can see them. Okay, again. Okay. You tell me which side moves. Okay, that's fine. I'm going to have you feel around your gums. Alright. Any pain here? Okay. Any there? Okay. And what about there? Okay. Good to go around the ear. On the side. Good. Okay, I'm going to come onto the face. Onto your sinuses. Or pressure. Okay. To that way, temples. Okay. Want a bit of breakouts on the chin. Is that normal? Okay. Just a bit on the jawline there as well. Sinuses feel good. The eyes feel good. Breakouts on the forehead. And just the odd one on the cheeks. Perfect. So fingers. No issues. Okay, well, we'll keep an eye on the breakouts. Alright. You finding it quite a regular occurrence? Okay. We'll see how they go. And if you try to maintain a good skincare, if you're still concerned, please book an appointment and I can always refer you on to a dermatologist. Okay. It's quite a new thing for you. Could be a little bit of adult acne. Okay. Yeah, if you give it about 4 weeks and then you can come back. Any issues, I'll get you referred straight away. Okay. Alright. Okay. I'm just going to feel your wrist, okay? Okay, and your fingers. Good. That side. Okay, your fingers. Ignore my hands. Squeeze for me as tight as you can. Okay, release. Perfect. If I could just have a feel around your hip. Alright. Okay. Okay. Other side, and then I'll get you to stand, alright. Okay, you'll stand up for me now. Just tell me when you feel pain. Alright, just there. Okay. Just bend for me. Okay. Push your hip out, like you're swinging your hips. Okay. Okay, that's a bit of a crunch. Okay, I'm just going to squeeze. Okay, let's check your knee. You stay there for me. Bend for me. And again. Whereabouts there? Okay. Other side. And just check your hip. Okay, bend for me. And again. Sway your hip for me. Squeeze. Any pain there? Okay. Just that. Okay. I'll just check your knee now. Bend for me. And again. Which one's worse, would you say? Your knees. Okay, and what about your hips? Okay. I'm going to hold your hip. Just sway for me. Bend for me. Okay, and relax. There's a little bit of swelling around the knee. And a bit of reddening as well. And your hips have got cracking, quite stiff. Just check. Yeah, that's right. Okay, take a seat. Have you been using ice packs or heat? Any preference? Okay. Right, I'm going to issue some naproxen, which should help with the inflammation. I'm also going to give you a special joint cream. You could use regular ice packs on your knees and your hips. You can use a hot water bottle or heat pads, okay? I'm going to issue some heat pads for your hips, see how you get on. And I'm going to give you a little bit of a higher strength cocodamol. If you could just take one of these when needed. Okay. Right. Once I've done your prescription, I'm going to finish off with a blood test. Alright, I'm going to add on a rheumatoid arthritis check. Okay, I'll tell you about that in a moment. So, 8 pack, a month's worth. Out to Naproxen if you take every 4 hours for me, but no more than 6 in a day. Okay, so we have heat pack with the eyes, we have Pyrrole, we have the naproxen. Okay. Okay, that is your prescription. If you could get that for me as soon as possible. Alright, my love. Okay. Blood test, and then we can let you go. And then we'll see you back in a year for your next exam. I'm sure I'll probably see you in between. I will be obviously keeping an eye on things because there's a few things I'd like to keep a check on. And just do some pumping for me with both arms. Take 2 bottles today. Okay, so on day 4. Do your usual routine, okay? Okay, so that one. Check your iron levels as well. Okay, add that on. And the rheumatoid. And your vitamin D. Okay, if I could just have a feel. Thank you. Oh, nice. It's fine, I'll do this side. We'll pop this on, even though you've got some good veins there. Perfect. Just clean the area. Perfect. Right. If you just relax for me. Okay. Sharp scratch. Good. Nice and easy. Okay. Let's press down. Just a little bit more. Okay. Okay, just press a little pressure on there for me. Okay. Okay, so You're okay now. Great. Blood ready to go. Right. Okay, my love. If you could go to reception and book yourself in for an ear cleaning. Alright. Yeah, it's all in the system. So as soon as they book you in, it'll be all flagged up. Okay. And I need to see you in, if we could get you in for 7 days. So if you can book an appointment with me for 7 days, I can go through your bloods and I can talk about your acne, potential acne, and a possible referral to a dermatologist. And I also want to refer you on for an x-ray on your knees and your hips. Yeah. What I might do is send you for a scan as well, like an MRI or a CT scan or something like that, and I may refer you on to a orthopedic specialist. Okay, all right, we'll see how we go, but we'll have a chat with you in 7 days. So we'll just put that down. 7 days, catch up, blood, results. No, I won't ring you, okay? I'll just see you in the appointment. Alright. Ear cleaning. Ear cleaning, you're probably looking at a couple of weeks. Alright. And hearing test at the same time. Okay. And then the results, the bloods. We'll talk about skin and joints, possible referral. And I'm going to arrange an x-ray for you. When you're gone, I will give the department a call and then they will probably ring you and get you booked in. All right, my lovely. Do you have any questions before I let you go? All right. It's my pleasure. At least we know you're all fit and healthy and everything's fine. Just a few little minor things, but you know, these things happen. All right. You're very welcome. I look forward to seeing you soon. All right. Don't forget to get that prescription. All right. You take care now. Bye-bye. Hello, lovely. How are you? Good. I'm very well, thank you. So, I'm Dr. Nicola, one of the practice doctors here, and I believe that you are a new patient here. Yeah? Well, thank you for choosing us. We really appreciate it. So, when you signed up, you filled in a few questionnaires and different things like that. Okay. Then we got all your medical records sent over to us. Okay, so we have everything now on file from your previous doctors. Okay, so you don't have to worry about that. It's all there ready on the system. Okay, good. And we have all the forms that you filled out too. So we have all that on the system as well. So we've got to worry about that. Okay, yeah. So what we do here is when we have a new patient come and they sign up, go through all the forms, then we get the medical records, then we ask you to come and sit down with your own doctor. Okay. Yes, that's right. So you will see my name above there because I am the main doctor here, if you like, All right, so my list can get very busy and very full very quick. Yeah. Yeah, that's right. But we take on enough staff and we've got enough patients, so you know, and everyone's not here all at the same time, so we can accommodate that. That's not a problem. I do get a lot of recommendations and people requesting me because my name's above the door, if you like. But I do want to assure you, all the other team here are incredible. I must say that. I mean, we've got a lovely bunch of female and male doctors, nurses, phlebotomists, pharmacists, you know, child section with, you know, the health visitors, midwives, everything. Did they give you a book? Oh, brilliant, they did. Oh, okay, right, you've not had a chance to look through. That's not a problem. We'll go through the book because it shows you what we offer here. So, you know, you've got things where you've got podiatry here, physio here, mental health section here. Then you have obviously the normal doctors section, and then you've got your midwives, health visitors, antenatal classes, and all sorts of different things going on. Yeah, that's why we've called it a health centre, really, because it's, you know, we've all got bits going on here and there. That's right. And that's mine. And then there's a doctor's surgery in here, which is where you are now. And then there is another doctor's surgery, which is the other side. Okay, that isn't a part of my surgery here, but they are a part of my health centre. Does that make sense? Yeah. You will get used to it. So the other place has their doctors. They have doctors and nurses as you would normally. Okay. And obviously they can use the services throughout. Then I have my team of nurses, doctors, and, you know, other things here, and we can use all the services within. Does that make sense? Perfect. But the good thing about this surgery is you can see me, but if you'd rather talk to somebody else about something else, or I'm not available, then you can see them, and vice versa. Okay, you don't always just have to see me. That would make it impossible for me to get through people. I always try to aim to meet my patients, okay, but I do my very best. But you know, if I'm off or away or something like that, and no slots free, but I assure you, I have a fantastic team here. I really do, and I really love my staff. I think they are brilliant. We've got some excellent doctors and nurses. They are all highly trained, qualified, and experienced. All right, but you'll more than likely end up keep seeing me, because people just tend to book me and then they just wait an extra few weeks to come and see me. But either way, you don't have to worry. Okay, yeah, don't have to worry about that. And for our first appointment, we have to do a little bit of a health check with you. All right, so I have all your files and everything on here, but I want to take my own, you know, tests and things, so I can have it all recorded myself. So I'm just going to ask a few questions, not too many questions, because that can get a little bit, you know, tedious. But if you do want to tell me anything along the way, then I can pop it down. Or if I do want to ask a question about something that is flagged up to me, then I'll ask you that. All right, but I just want to be, you know, knowing a bit about you, your lifestyle, and about your conditions and your medication, and are things, you know, okay, moving all right with everything, and do you need any help with anything? And then I just need to do usual kind of, you know, blood pressure, blood test, urine sample, all those kind of things, if that's all right with you. Yeah, and I've got all that up to date then, and then we'll see how we move forward. I think that will be a good thing. But what I'm going to start to do, first of all, I'm just going to load this page up for you. Just hang on a moment. Okay. Right, can I get you to just confirm your date of birth? Okay. And the first line of your address and postcode. Brilliant. And finally, a contact number. Excellent. That's brilliant, thank you. Okay. Okay, I see you are on a couple of medication. I would just like to give you, in your own words, just to tell me what are you on them for. Right, yeah, okay, that's fine. Yeah. Yes, okay, that makes sense, yes, okay. Right. And when did you last have a medication review? Okay, so your other medication you would say you're okay on. Okay, and what about the mental health medication? When was the last review? Right, okay, so I could possibly get you in at another date, I think, maybe, and just go through your medication. Do you think that would be okay? I mean, do you feel like you need changing, lowering, upping, or? I suppose, yeah, and with the weather changing at the moment and the year that we've had and things like that, I can understand. Okay, let me just jot that note down. So, medication review. Because then I can just see you then, and I could do a medication review, and if you wanted a mental health review, yeah? Okay. I mean, we might as well. I mean, you know, we can have a good chat. I can get to know about your mental health and things that's going on and talk a bit more about it, and then I can see if you need any help with anything, and, you know, we can go from there. Oh, you're very welcome. You don't need to thank me at all, honestly. I'm here to help you and look after you. All right. Okay. But don't worry. I will definitely book in a medication review and a mental health review with you. Okay. Okay. Make that a double slot. Okay. That's fine. So, everything that I have on the system for your illnesses, has there been anything diagnosed since, before the move and things like that? Okay, anything gone that was there? Okay, no, so it's all up to date and fine. Brilliant. Not a problem at all. Great. That's wonderful. Right then, what I'm going to do, I'm not just going to start with asking all questions. I'm just going to do a little bit and pop some questions in here and there, if that's all right with you. All right, lovely. Okay, so what I'm going to get you to do first is give you a bottle, and if you could go and do me a urine sample, please. Do you have yearly bloods before? Right. Okay. So you should be having regular yearly bloods, checking things out, especially with those medications that you are on. Okay. Okay. All right. So here is your sample pot. If you can just fill it to about there. Don't worry if it's a little bit less, a little bit more, please don't panic. Just so I've got enough to pop my strip in there. Alright, my love. So there we go. Okay. Yes, if you just go down the corridor, it's on the right. Okay, see you in a moment. Okay. So I've got medication. That's fine. Oh yes, you can come in. Oh, thank you, that's great. Please take a seat. Are you feeling okay? Good. Okay. So okay, here we go. Seems a nice healthy colour. Just say that's pretty normal for you. Okay. Okay, let's put that on top of there. Okay, just leave that a moment. Do you ever have any problems with your waterworks at all? Okay, that's really good. Yeah, these look really, really good. Fantastic. All clear, no problems at all. Let's put those in the bin. Right, while I pop these gloves on, if you wouldn't mind just popping over there on those scales and just standing on there nicely for me. Do you know what you weigh with your hair? Do you remember? Or... Okay, do you know when you were last weighed at the surgery? Okay, don't worry. You're going to pop yourself on there for me. Okay, right, come over to you. Okay, so you just stand Okay. That's fine. Perfect. Okay. Stand down for me. And you can just pop your feet right there against the board. And I'm just going to move that level. Okay, stand nice for me. There we go. Okay, that's fine. Thank you so much. Yeah, so you can go and take a seat now. All right, thank you. All right, so height, weight 2 kilograms. We are okay, so I'll just try to work that one out. Okay. Okay. So it's not too bad actually. It's quite good. Okay, so your BMI is matching up quite nicely. Okay, so I'm not concerned about that. How do you feel about your weight? Yeah, are you happy with yourself? Good, good. Yeah, well, we'll worry about that in the new year after Christmas. I mean, I'm not even attempting to try and lose any weight at the moment, or exercise or tone up. No, I want to treat myself first, so you treat yourself. But you look absolutely amazing, so, you know, you're doing a really good job. Yeah, looking at you look really healthy, you know, so, but it's a personal thing sometimes, isn't it? But, you know, try not to, you know, push yourself too hard. Okay, enjoy Christmas first. Right, okay, so let me move on. Where are we? Okay, so I'm going to check your temperature. Okay. All right. Lovely. It's normal, around 37 degrees. Okay. So great. Okay. Where are you? Is it okay with you if I just have a little look in your ears? Yeah? Okay, thank you. Okay. There we go. Perfect. So put that on there nicely. Okay, so we are nicely Okay. Going to come a little bit closer. All right. Okay. There we go. I'm just going to pop that in now. No blockages. No reddening. Absolutely nothing at all. It's great. How do you clean your ears? Ah, whatever you're doing, it's working wonders. Oh, do you? Yeah. Poppy ear candles. I've tried them once or twice before, but I must be doing a really good job to you. I might have to give it a go myself. Right, let's check this side. Okay, I'm popping it in. There we go. Ah, that's pretty much the same this side too. Really, really nice and clean, and really looked after well. And is your hearing okay? Okay. It is. Okay, that's really good. So you've no hearing issues, or that's fine. Is there any hearing problems in your family? Okay. All right. Let me just pop the ear check down. Okay. Right. Do you wear glasses or not? Okay. Right. First of all, I'm going to pop a finger up. I want you to tell me what number you can see. Yeah? Okay. So, the first one. Yep. Yep. Good. Yep. Good. And are they all right to see, nice and clear, not blurry? Perfect. Okay. Same again on the other side. Good. That about. Yeah. Yep. Perfect. And they were okay, clear to see, not blurry. Okay. Same again, but straight ahead. And I'm going to pop different amounts of fingers up. But I need you to look straight ahead. I need you to see if you can see what's going on aside of you. Okay, so like your peripheral vision. Yeah? I will be a bit here, there, maybe a little bit close and things like that, okay? Alright. Okay, you ready? Good. You're doing well. That's it, perfect. You look at my nose. Mm-hmm. Good. Now this side. Perfect. Okay, same again, but I'm going to do both sides, okay? So I might move this side, I might move that side, but I need you to look at my nose. Okay, ready? Good. Right. Don't look so worried. You'll be alright. Okay, ready? Good. Okay. That's good. I'm watching the concentration. Yep. You see that okay there, yeah? Sure? Okay. Okay. Alright. Yeah, I just thought you were a little bit hesitant, that's all around there. Don't worry. I'm just going to concentrate on here. So we're going to do the same type of thing, but just numbers 1 and 2. Okay, so like 1 finger or 2 finger, etc. Okay, good. Okay. Good. That's it. Do really well. Good. Excellent. Perfect. Very happy with that. Well done. Okay, if you look at me, nose, I'm going to put my hands here and I need you to tell me which side you saw move, but without looking directly at them. It's a bit like what we've done just. Okay. Good. Good. That's it. Perfect. Okay, closer in. Good, good. Get a bit further out again. Ready? Perfect. And now I'm going to do it a lot closer to you. So about here. Okay. Look at my nose. Okay. Good. It might have helped though that it was by your ears. Don't worry, I believe you. You'll get used to me. Yeah, no concerns there at all. Brilliant. Are you up to date with your eye check? Good. Eye check. Perfect. What about your dentist? How often do you go to the opticians? Okay, do you make sure you do go? Good. What about the dentist? Good, that's really good. Make sure you keep that up. Alright, brilliant. I'm not going to assess your teeth or anything, but I will just take a quick look in your mouth if that's alright. Thank you. Okay. You can open wide for me first. Tilt your head slightly. Thank you. Stick your tongue out for me. Nice, healthy colour. That's good. Okay, I'm just going to pop that in now. That's it. Excellent. You can say R for me. Good. Okay. Okay. Wonderful. Okay. Thank you. Put that down now. Your teeth look fine, your gums look fine. Can't see any ulcers or any thrush or any lesions or anything like that, so it all looks really good. So, very pleased with that. Okay, so that's hand sanitised. Right. I'm now just going to have a little look in your eyes. I'm not going to do too much, alright? Just want to have a little look myself. Okay, just look at me. Thank you. What beautiful colour eyes. So pretty. And big. All looks healthy in that. All the whites are nice and white. Which is good. Pupils, really attractive as it should. No yellowing or redness. Okay. Good look at me. Good. Perfect. Your eyes look really healthy. Which is really good. Okay, now I'm just going to do a little hearing test. What I mean by that, it's nothing fancy. I'm literally going to get you to close your eyes. Okay, I'm going to put my hands either side of your ears, and I need you to tell me which side you heard. Okay? Get a little bit closer. Right. So close your eyes for me. Thank you. Okay, and now we'll begin. Doing well. Good. Okay. Perfect. Now I'm going to whisper two things on either side of your ear. Repeat it for me. Okay. Chocolate. Chocolate. Okay. Next word. Good. Now two different words this side. Cucumber. Cucumber. Okay, and second word. Relax. Relax. Excellent. Well done. And you can hear everything perfectly fine. No issues at all. Perfect. Excellent. Right, so I'm really pleased about that. Do you experience any blurred vision, double vision, any spots crawling or anything like that at all? Brilliant. Fantastic. That's really good. So, where are we? I'm going to have a listen to your chest now, and what I'm going to be listening to is your heart first, okay? Alright. Okay. Could you just move your top up slightly for me? Thank you. This may feel a little bit cold, so I do apologise. If you can just breathe normally for me. Okay, thank you. Any heart issues in the family at all? Okay. Okay. Right, can you just relax for a moment? I'm now going to listen to your lungs, okay? So I want to hear you breathing. So, let me get that back in my ear. If you can start by breathing normally, okay? Okay, might be a bit cold still. Okay, so normal breathing. That's a nice breaths. Okay, start to breathe a little bit heavier, so a little bit deeper. That's it, like that, thank you. Okay, now can you take a deep breath in for me and hold it and release. That's it, that was perfect. And again. Okay. And again. And one last time for me. That's it. Perfect. Okay. Okay. That's really good. You can pull your top down. Okay, so just check your pulse. Index finger in that for me. Thank you. Stay nice and still for me. Okay, perfect. Thank you. That is perfect. So let's put some rate. Okay, that's good. Okay, I'm now going to do your blood pressure. Okay, so I'll take this arm, just relax it on that table there for me. Okay. Pop that there and wrap that right round you. That's it, just like that. Okay, good. Okay, so that's there. Pop these in. And pop that on your, there we go. Right, just relax for me, okay? Don't move and don't speak, but don't stress. It's going to start going quite tight. Right. Yeah, there we go. That's fine. Okay. So the rest should come out in a moment, alright. Okay. Okay, that's fine. Before I take some blood, I just want to ask you if there is anything that you are concerned about at the moment with your health. Okay, so you're feeling alright? Good. Yeah. Okay. Well, in the mental health review we can cover that. Yeah, don't worry, I won't leave you too long. Yeah, I'll try and get you in next week if I can, if that will be any help to you. Yeah. Okay, it could be a little bit of SAD, seasonal affective disorder. Do you feel like this quite often, or? Okay, let me jot that down. So, do you mental health review and questioning SAD? Okay, so you've got so you're lethargic, you say, fatigue, miserable, depressive, want to sleep. Okay, anything else? Okay, so yes, so other typical depression type symptoms. Okay, you can actually, yes, even though you've got mental health issues and suffer with depression and things, you can still actually get SAD on top. I know most people think you can't, but you can. Yeah, and it's always things that we look at is how tired you are, you know, are you going out, so you get enough sunlight, and it's hard when it's always dark here and gloomy at this time of year. But I won't go into too much detail about that yet, because I'm going to add a couple of tests into the blood test, which I want to do first, okay? And I want to see you, and it will have to be quite a bit of a longer appointment when I see you next time, because we're going to discuss the medication and the mental health review in general, but then I do want to discuss SAD with you. Okay, yes, definitely. And I can give you some information sheets and things, so when I've looked at your blood, it can get me a little bit more of an insight too. Yeah, if you don't mind. I would like to do it properly, you see, I don't want to rush it. Okay, thank you. Don't worry, I'll have a look for you in a moment. It does sound like it, but I do want to be sure. Okay. But other than that, everything's okay. Perfect. That's great. Right. Do you have a best arm? It's totally up to you. I mean, if you want to do some pumping action for me first. Yeah, just with the both. Do that for me whilst I get it sorted. Right. Those. Are you alright with normal plasters, or would you like me to use a bit of cotton ball with some tape? I know some people can be a bit allergic to that, and can leave a little bit of a red irritation. Yeah, I don't mind, whichever is best for you. Okay, that's fine. No, not everybody asks, but you'll just stick anything on that to you. Okay, then I'll pop my dose off for you. Yeah, I can do that. So, not a problem. Relax a moment, let me check. Maybe one there. About that side. I'm going to go for that side. I've had the blood pressure on there, so it may have helped it a little bit. Okay, so I want that. One of these. Little one. To be honest, I prefer a plaster. Well, I prefer nothing actually. I prefer just to let me hold the cotton pad on and that's it. But if I had to, then I would choose a plaster. Okay. Let me just get this. So we'll do 2 tubes today. Okay, so tubes. Okay, so bloods. Okay, so full blood count, function, TNT, iron, forms, sound, Is there anything in particular that you would like me to test for out your blood? I've done the ones that I would definitely need to do and would want to do. Is there anything you feel that you would like me to test? Okay. No, okay. Yes, alright, I will add that one on. That makes sense. Okay, thank you. Okay, so if I'm going to do that, then I'm going to add the other one too. Yes, okay, that's fine. Okay, so that. Okay. 2 should be enough for that. Okay. Okay. Once I've done this, I'm happy for you to go and enjoy the rest of your day. Okay. Okay. More on for me, thank you. Okay, let me just check. Yeah, that's good. Right then. Okay, just leave your fist like that for me. Okay. Let's control your breathing. Think about your breathing. Can you feel a sharp scratch? No. That's good. So you're doing really well. Okay, and just the next bottle. Now I can take that out and press. You're right. Good. Is that alright for you? Yeah. It's alright then. As long as I didn't hurt you. Yeah, they can be a bit sharp, but you know, I know some people say it's not very comfortable, and others they can't feel it, and others they say it hurts and all sorts of things, but it shouldn't do at all. The more water and fluid that you drink, and the more relaxed you are, really does help. But it also helps if you have a good doctor doing it, or a nurse. Okay, that's stopped now. And the bin, I'm just going to pop this on it just in case. Okay, there we go. I'll put that down nicely. There you go. I'm done. Right. Okay, just put pin on that. Right. So take perfect. That's brilliant. So I'm going to that. So perfect. I will get those sent off today. Okay. Yeah, they'll be all sent off and should be back in a couple of days. Okay, right, I'm happy now with the check, alright. I'm going to just book you in now, the appointment for medication review, mental health review, and to talk about SAD and have a discussion, see if you do have that. Okay, so let me look for next week. Okay. How is Wednesday? Same time. Great. I'll pop that in. So look through the days of the week. 2, 3. How is Wednesday at the same time? Great. That's all booked in for you. Okay, right. So the bloods I should get back within 24 hours or so. Okay. I will probably wait to see you to discuss them with you. Okay. Yeah, it's only a few days, so you know, give us time to get them through and sorted and things like that. Okay. And then we can go through our review on medication, and we can also go through a review on your mental health, and then obviously discuss everything with concerns around SAD, and obviously discuss your blood results and take things from there, if that's okay with you. Great, not a problem. And I will say, make sure that you sign up online for the patient access service. Okay, that'll be really useful for you to do. Okay, you can book an appointments on there, request your medication. You can, you know, find out all sorts of information, things like that. It's really, really useful. Okay, all right, and then you'll find a lot out about here as well and things like that, so be very useful to have. Okay, do you have enough medication, or do you need me to print you some? Okay, what I'll do, I'll just print you one off now with what we've got on the system, just so I've got enough. I don't want you to run out. Okay, I know it's only a few days, but you know, I don't want you to get yourself all stressed out. Okay, I'll do that one for you then. Okay, so let me see if it's going to let me print it. It didn't work earlier, so I may have to write it. Let me just check. I think it's going to be playing up again. Typically. Okay. Just make sure I have everything. Okay. Right, just remind me of your address, please. Okay, and postcode. Excellent. What's your name? Date of birth, fine. That's not a problem. Okay, so we want 14 days worth of those. Then 14 days of this. Fine. Excellent. There we go. That is your prescription. Okay, if you could get that as soon as you can, that would be really great, just to make sure you don't run out. Okay, and then I will see you on Wednesday at the same time. Okay, it's an absolute pleasure to meet you. It really has. It's been lovely. Yeah, but don't worry. I know you're looking a little bit stressed out about your mental health and things, but you know, we'll get this sorted. Physically, I can't see any issues, and you said you are feeling fine, and the issues that you do have are all under control, so everything is perfectly fine, so don't worry. I know when mental health triggers off, it causes all sorts of worries and concerns. Yeah, I get that. I really do. So I can understand why. Yeah. All right. Okay. Well, you have a lovely weekend. All right. And have a nice week. Yeah. All right then. Yeah, don't worry about it. No, honestly, don't worry. Don't worry about it at all. No. Don't think of it like that. Don't. Okay. All right then. You take your time and, you know, come back and see me, and then we can go from there. All right. You take care now. Bye-bye. Hello, lovely. How are you? Good. Nice to see you again. How have you been? Well, that's good. Oh, I'm glad to hear that. So everything's okay at home and at work. That's good. So, my love, let me just open your file. Can you just confirm your name? Okay. Date of birth. Excellent. And your contact number. Excellent. I don't have an email address for you, but is it okay if I can take one? It's totally up to you. Basically, what we are doing now is emailing our patients with their appointment reminders, medication reminders, helpful, useful tips and things like that. Yeah? Okay, wonderful. When you're ready. Just repeat that. Excellent. Thank you very much. So, you can see you had some bloods done recently with the nurse. They have all come back perfectly normal. Okay, so there's no concerns whatsoever with your vitamin D. Liver function's fine, full blood count's fine. That one's fine. Glucose is fine. Cholesterol, that's good. Yep, they're all perfectly normal. Okay, and the ones, if they are slightly elevated, are still in the normal range, so it's perfectly fine. Okay, and I see that you had a urine test done with her as well, and that was perfectly fine, all clear. Okay, and you recently had a height and weight check. Okay, so your height is going to be the same, obviously, but if I can just get you to pop on the scales for me just over there, just so I can take my measurement. Okay, thank you. That's virtually the same. Good. So that's all looking on track, perfectly fine. Right. Have you had any issues at all? I know you said you've been fine, everything's been great, but have you been experiencing anything? Okay, so probably a little bit of stress. Okay. And how's your sleep? So a little bit drained, a little bit fatigue, and not sleeping great. All right. Any particular reason why, or it's just happening? Okay. Right, that makes sense. Well, I'm glad. Try not to overwork yourself, though. All right, make sure you do take some time for you. I mean, you've got an amazing job, and I know you love it, and everything's going well, but just make sure you relax a little bit and take some time for you as well. I think you're a little bit exhausted. Yeah, so I think you need to take a little bit of a step back and just reevaluate the situation. All right, my lovely. Okay, so I think you just need to take 10 minutes a day just to recoup. You know, just do some breathing exercises, listen to some ASMR, just be present in the moment, you know, maybe read a book, have a bath, you know, spend that time just to do something for yourself, you know. And, you know, you say you used to go for daily walks, but now they're every other day. Why don't you just allow that time on every day just to get that, you know, walk in, a little bit of fresh air, yeah? Listen to the nature and sounds around you, okay? Try that for me if you can. If that's something that you want to do and that's what you're used to doing and you're feeling a bit bad that you're not doing it, then I suggest you make that effort to fit it in. If you weren't doing it in the first place, I wouldn't really say do that. I would just suggest it as something if you wanted to. Okay, but make sure you're allowing some time for you, even if, you know, going to the salon once a week for a massage or something like that. Whatever it is, you know, just make that time. All right, my lovely. Try to go to bed a little bit earlier if you can. All right, try to get your brain to switch off. Phone down, you know, an hour or so before, and make sure you put a blue light filter on there as well. You know, just to help a little bit. Try not to have any caffeine, you know, in the evening. Drink more water. Yeah. And then hopefully you'll get up feeling a bit more refreshed as well. Okay. Yeah. I know you know all this, but sometimes you just need somebody to, you know, reinforce it and help you get into that mindset again. All right. I mean, you work incredibly hard, and, you know, it's time that you just, you know, be present and, you know, take a step back a little bit from it all. All right. You are looking a little bit tired and a little bit drained, if I'm honest with you. I mean, your skin colour is, you know, it's a good colour. Probably a little bit of dark circles going on. If I remember rightly, it wasn't like that last time. So, yeah, lack of sleep. Yeah. But, you know, your skin, looking at you, you know, possibly a little bit dehydrated, which is showing in your skin. But other than that, your skin's looking really healthy. Yeah. Just looking at your eyes, a little bit red, and there is probably, again, lack of sleep. But please don't think that's a bad thing. You do look fantastic. But me as a doctor, obviously, I'm looking out for these things. All right, that could be why you're getting the odd headache here and there as well. All right, does that make sense? Okay. That's probably going to impact on your mental health. Yeah, I mean, you say you're feeling good, but, you know, in the long run, it could get too much. So, I mean, diet's all right, it's balanced, isn't it? But it could be better. So it's, you know, allowing that time to make sure you have something to eat 3 meals a day rather than just grab a quick chocolate bar or a big packet of crisps or something like that and rushing around. Try to make that time to sit down and have something to eat. Yeah? Okay. How's your alcohol intake? What about caffeine in general, other than Coke? How much are you having? Okay. And I know I asked earlier, but everything okay at home? Happy? Life's good? Wonderful. No concerns? Great. Well, that sounds perfect then. So, let's just do some basic checks. Okay, I'm just going to listen to your chest, alright? Let's warm this up. Okay, pop that. Yep, thank you. Breathe normally for me. a deep breath in for me. Hold it. Release. And again. Hold. Release. So put on the back. Breathe normally. Take a deep breath in. Hold. Release. Normal breathing. Take a deep breath in for me. Hold. And release. Have your wrist. Okay, just normal breathing. Perfect. Right. If I could have your index finger. Thank you. Relax for me. Oxygen levels good. Pulse rate good. Wonderful. Let's check your temperature. Okay. The other side just to be sure. Perfect. Okay, so great lungs. Good. And good. Excellent. Right, my love, I'm just going to have a little look in your eyes, okay? Look at my nose all straight ahead for me. Okay. Good, well done. Good. Look here. Look here. Good. There. There. Well done. Look up for me. Just your eyes, that's it. Back at me. You look to your left. To your right. Back at me. Perfect. Blank. Blank. Blank, blank. Blank, blank. Blank, blank, blank. Perfect. My nose. Look here. Look here. My nose. Good, good. Back at my nose. Perfect. Well done. Perfect. Let's do your blood pressure. Okay then. Put it on there. Okay. Just relax for me. Feet nice and flat on the floor. tight now. Thank you. That's perfectly normal. Okay. Have a look in your ears. Okay. Stay nice and still for me. I'm just going to pop it in. Okay. Looks really good, nice and clean. Lovely. Let's go a little bit deeper. Yes, not too bad. Average amount of wax. Looks great. Wonderful. The side. Here we go. Yeah, looks good. Looks nice and clean. Let's go a little bit deeper. Yeah, looks good. Both ears look perfectly healthy, no redness, no swelling, no build-up of wax or anything like that. Looks good. Alright, my love. Now, can you just repeat these 3 words for me? Okay. Spritz. Chocolate. Coconut. Okay, and through this side. Good. Pineapple. Bubblegum. Brilliant. Now just tell me which side you hear my fingers move. Excellent. And your hearing is brilliant. Okay. Let's pop on some gloves. You all right? Good. Wonderful. Let's put a new one of those on. There we go. Right. I'm going to have a look at your nose. tilt slightly. Thank you. Sniff. Okay. Sniff. Okay, wonderful. Looks good. Open your mouth for me. Thank you. Pop out your tongue. Looks a little bit dehydrated. Roll up your tongue. Okay. Okay, just relax. Say R. Okay, I'm going to put this in. Say R. Okay. Just cough. Good. Okay, my love. Just pull that down. Look at your teeth. Good. Pull chin. Good. Well done. I'm just going to feel your tongue. Your mouth is quite dry. There's not a lot of saliva in there. Do you find that a lot? Okay. Okay, right, I'm just going to go back to your eyes and we're just going to pull down. Up. Okay, down. And up. Close your eyes. Any pain at all? Good. Okay, open. Open wide for me. Okay. Okay. Relax. You feel everything I'm doing? Good. Any tingling anywhere? Okay. Any numbness? That's good. Okay. Good. Just let me know if you feel any pain. Feels good. Okay, to check these glands. for your scalp. Perfect. Scalp, ears feel fine. No problems there. I take it you had no pain at all. Good. Lovely jubbly. Can I get you to cough? Again. Okay. Can you laugh? Sniff. Sigh. Okay, good. Put your arms right up in the air for me. Back down. Back up. Down. Put your arms right out in front for me. Good. Bring them around, put them up your head. And rub out behind. Okay, good. Rotate your shoulders for me. Back the other way. Both together. Try and do the one. The other. Shrug. Okay, that's fine. Give me your hand. Squeeze hard as you can. Good. The other one. Squeeze hard as you can. Excellent, well done. Let me have a look at your fingers. Looks good, fingernails look good. Okay, other one. That's good. That's perfect. Okay, how are you feeling? All right, good. Excellent. Okay, straight ahead for me. Keep your eyes wide. Well done. Blink, 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 wink, 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 blink, blink, wink, blink, 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 wink, wink, blink, blink, blink. Excellent movement there. Well done. Look at the skin just with this. The skin looks good. Wonderful. Do you have any questions? You sure? Okay. 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 Take a look at this. Yep. What's this? That letter. Read any of these? About any of these? You sure? What colour's that? Yeah, what colour's that? Can you read this? Need anything else? Try. Keep trying. Are you sure? Okay. Good try. Well, there we go. Everything is done. No concerns whatsoever. Okay, 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 okay. Good. Excellent. There we are. Everything's complete. I'm very happy that you are doing amazing. All right. You're very welcome, my lovely. I will see you again very soon, I'm sure. You're welcome. You take care now. Bye-bye.